The news this week that 18-year-old Bronny James, a promising young college basketball player and the son of LeBron James, had gone into cardiac arrest during a practice at the University of Southern California, sent shockwaves across the country. The incident came just 2 days before Damar Hamlin returned to the field for the Buffalo Bills, less than 6 months after he collapsed in cardiac arrest during a Monday night football game. The high-profile cases have led to an increased focus on the heart health of young athletes seemingly in peak physical condition and a call for widespread screening. NBC News senior medical correspondent Dr. Torres has more in our Sunday Focus.
He's known as King James, LeBron, one of the best to ever play the game.
2-on-1 LeBron, hold on, here he comes!
His son Bronny, an incoming freshman at USC, hoping to follow in his father's footsteps. The 18-year-old, one of the hottest college prospects in the country. And then, this week, the 911 call every parent dreads.
Listen to me, okay? Get ambulance here now.
Bronny James had suffered a sudden cardiac arrest and was rushed to the hospital. Amazingly, he was out of the ICU within a day and went to dinner with his family in Los Angeles on Friday night. On Saturday morning, his dad posted a video on Instagram of Bronny playing the piano. The frightening episode putting a spotlight on the health of school and college athletes.
It's very difficult to see someone who's young and looks outwardly healthy have a sudden cardiac arrest, but it really highlights the fact that there can be underlying cardiovascular disease that goes undiagnosed.
The scare came less than a year after another USC player, Vincent Iwuchukwu, suffered a similar cardiac event, collapsing at practice last summer. And the world was watching when Buffalo Bills defensive back Damar Hamlin went into cardiac arrest on the field last January after making a tackle. Hamlin tweeting his support for Bronny this week.
Research has shown that basketball and football are really the two that are most associated with sudden cardiac arrest. And we do see the highest numbers of sudden cardiac arrest in male African-American basketball players.
According to the American Heart Association, 1 in 300 young people are at risk for sudden cardiac arrest, and approximately 2,000 athletes under 25 die each year. Are those numbers underreported, do you think?
Medical experts believe that that is underestimated, that it's the tip of the iceberg.
Martha Lopez Anderson is director of advocacy at Parent Heart Watch and lost her own son, Sean, to cardiac arrest. She now advocates for increased awareness and training around cardiac emergencies.
A lot of times, parents assume that their school or their child's sports team is prepared. And what I can tell parents is don't assume, make sure, ask.
Alongside increased heart screening for young people. She recommends parents also check that schools and sports facilities have accessible working AEDs or automated external defibrillators, that there is a clear cardiac emergency response plan, and that teachers, coaches, and even parents themselves know CPR. Everyone should be empowered with life-saving skills. That is the only way we're really going to change the paradigm of sudden cardiac arrest in our country. Health experts agree. They say if and when a cardiac event does occur, those first few minutes are crucial.
That immediate treatment is everything. We know that bystander CPR can double or triple someone's chance of survival. Early defibrillator use, early bystander CPR can absolutely save lives, and we've seen it in the case of Damar Hamlin and now with Bronny James.
And Dr. Torres joins me now live. Dr. Torres, good morning. I imagine every parent of a young athlete about to start fall sports is watching your report with a bunch of questions saying, okay, you have my attention now. How do I test my child? Where do I test my child? And will insurance cover it?
And good morning, Willie. You want to make sure your child, regardless of their age, has a thorough pre-participation physical examination before starting any activities, following the evaluation form that's been adopted by many expert organizations. Now, this test is going to include a history and a physical. That might point to additional testing that could be needed, like a stress test or maybe additional heart testing. So the best place to do this is with your child's family physician or pediatrician. Ask them about the form and then start from there. Now, coverage, that's going to depend on your type of health insurance, but these kinds of evaluations are usually low cost unless some of those additional tests are recommended.
Great information. And it does have to be said, as it was with Damar Hamlin and the Bills trainers, it appears the training staff at USC did outstanding, life-saving work with Bronny James.
Exactly.
And we're so happy he's back home with his family. Dr. Torres, thanks so much for bringing us that report. We appreciate it.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.